Ontario this week recorded record levels of infection and death from COVID-19. That after Toronto Public Health said it would start publishing the names of employers where significant outbreaks were happening. Will that help? And what else should be done to get workplace spread under control? With us to consider that in Hamilton, Ontario, Dr. Martha Fulford, Associate Professor in the Division of Infectious Diseases at McMaster University. And in the downtown core of the provincial capital, Victoria Arrandale, Assistant Professor at the University of Toronto's Dalla School of Public Health. Welcome to you both.
Thank you.
And Happy New Year. Before we start our conversation, I wanted to show a clip of Dr. Eileen de Villa from earlier this week, who is the Medical Officer of Health for the City of Toronto. And here she is explaining the new measures the city is taking amid a surge of new infections. Sheldon, please roll.
Today, the COVID-19 dashboard will include new information to further illustrate the characteristics of the virus in Toronto. The website will provide more specificity about workplace-related outbreaks across 11 categories, including workplace settings like grocery stores, pharmacies, food processing sites, offices, warehousing, shipping and distribution, construction, and manufacturing facilities. Additionally, Toronto Public Health is implementing a system to share specific information about workplace outbreaks without compromising individual privacy.
I want to get your reactions from the announcement. Dr. Fulford, I'll ask you first. Can I get your reaction to the City of Toronto's decision to begin reporting workplace outbreaks?
I think it's important to understand exactly why, and I'm hoping that it's not for a naming and shaming and blaming, and I don't think that's the intent. But if it helps us understand exactly where transmission is occurring, that is helpful. Right now, we've of course had a very broad brush approach of shutting down all businesses, and it may be, for example, that small retail is not a risk. It may be that restaurants are not a risk, and understanding in more detail where we are seeing transmission would be helpful in terms of targeting interventions, and not to be punitive, but to try to understand why. Is it that there are no appropriate break rooms? Is it happening because of face-to-face encounters? Is it deliberate or is it accidental? So I think if we can understand and intervene in a way that actually helps businesses carry on, that's very useful. I would just sincerely hope that it's not going to be used to name and shame, which I think we all know has been happening in certain areas.
And Victoria, what is your reaction?
Well, I think it's an improvement. I think since the beginning of the pandemic, many people have been asking for more information about workplaces and workers and where we're seeing increased risk. So I do think it's an important development. I think the piece that maybe wasn't touched upon on the clip is this new requirement to have workplaces sort of self-report to Toronto Public Health if they have 2 or more cases within 14 days. And I think that's going to be quite helpful. I mean, obviously it relies on the employers to make that phone call or send that email. But I do think, as Dr. Fulford mentioned, that if it is going to help us better understand where transmission is occurring, it is going to be a positive.
Can you, Victoria, can you give us a definition of what an outbreak is?
Well, the definition of outbreak seems to depend on who's using it. In this case, the trigger point is those 2 cases within 14 days. And at that point, under the announcement that was made, the employer would then have to notify Toronto Public Health. The naming of the employers or the workplaces happens under a different framework, at least as per my understanding of the announcement, that would only be done in very select cases where I believe Dr. de Villa, as she said, it's when there be a large proportion of the workforce affected, a long duration of an outbreak, or where they did feel there's a public health risk associated with the outbreak. So in my mind, there is 2 pieces to this shift that's happening in the way workplace data is being collected. And I agree, I don't think the naming and shaming is particularly useful, but I do think that having more information in the system about workplaces is valuable.
You said that there's 2 pieces to this. What are the 2 pieces?
So that first piece is around if there are 2 cases within 14 days. Now, Toronto Public Health is requiring employers to report, to disclose to Toronto Public Health. So previously they didn't have to do that. And then the piece that seems to be getting a lot of attention is this concern or this new approach in the dashboard to actually name businesses where there are these larger outbreaks.
And all of this, of course, requires on individuals, coming forward and saying that they have COVID, or even in the first place to get tests. And I understand that you both don't work for Toronto Public Health, but I wanted to address sick days, because I think when in Ontario, most people have 3 days for sick days. And with COVID, it's a whole new ball game. Even just to get your results, sometimes it can take between 2 to 4 days. Do you think that that component, it's one thing to for workplaces to report the numbers, but maybe there's another piece about sick days that we should be also talking about. Dr. Fulford, in your opinion?
Well, that's actually very important because people do need to work. They need to feed their families. They need to pay their rent. And if we aren't actually providing a safety net for people, it's a very difficult situation. And of course, there are some jobs or businesses where they're not going to be able to shut down. And so again, if doing this allows for a much better analysis of why there are breaches going on, but it does depend on an honor system. And if somebody is asymptomatic or only mildly symptomatic and it's their livelihood at stake, and we are not providing any sort of a safety cushion for them, any kind of support, you can understand why they're not might not be the strongest incentive to put yourself forward to be tested. Obviously, we are hoping that people will be. We desperately want transmission to come down, but there is a very important human factor here. People need to survive, and without that safety net, we're not doing everything we can.
And Victoria, the mayor, John Tory, has encouraged people to do the right thing. But I think people do want to do the right thing. But if you do find yourself in a situation where you could potentially lose income because you are sick, are sick days important to include in this conversation?
Yeah, I think they're a really important part of the larger social discussion. I mean, the paid sick leave really does need to be in place if we want people to stay home when they're sick, which is really one of the pillars of the public health recommendations. And, I would note that that's not within the scope or the ability of Toronto Public Health to implement. They do need other levels of government to act on that particular aspect. I know in the conversations that I have, we do encourage workplaces to perhaps communicate more than they would in other settings about the supports that are available. There are federal level programs that might be applicable, but they don't cover everybody. And so I do think that this policy discussion around paid sick leave is really critical to society getting through this.
Amazon was one of the places that was reported to have outbreaks in the hundreds, and they've said that they would give their employees up to 2 weeks leave. Dr. Fulford, when we've been hearing about outbreaks in long-term care facilities, how bad is the problem in workplaces like factories, warehouses, and grocery stores?
Well, that, of course, is one of the reasons why knowing where the transmission is occurring is going to help us. There have been some severe outbreaks in certain settings, like some of the meatpacking plants earlier on, some of the warehouses. But again, some of this information hasn't been as transparent as we would like. And so that's where understanding where transmission is happening is very helpful. But part of that is also going to be understanding why it's happening. What are the barriers to good infection control in a workplace? And for example, is physical distancing impossible? Are the break rooms inadequate? Do the staff have enough time to actually take mask breaks? I think we all know it's extremely difficult to have a mask on your face all the time. And we need to provide safe spaces where somebody can sit with appropriate physical distancing and have a mask off, have their coffee, have their food. In hospitals, we have excellent infection control in our hospitals, and where we have had breaches have always been in situations like break rooms. And so knowing where the outbreaks are occurring is, I think, a huge step forward. Also because it might help justify, or not justify, but allow smaller business to reopen. It might allow a much more considered and appropriate reopening of the economy when we no longer need any sort of a lockdown. But I do think that part of this, I hope will go along with an educational component for the workplaces, and a good look at why it's happening. There's another thing we need to discuss along with sick leave is actually quarantine space, because some people live in multi-generational homes, they live in crowded settings, and we haven't actually given or thought about where can people go if they can't isolate. So there are a lot of social factors that, yes, aren't part of public health, but it is a societal conversation. If we're asking people to do these things, we need to actually give them a way to do it.
I believe the city of Toronto has hotels now where people can quarantine, but I don't know if that's like everybody knows that.
No, I don't think.
Yeah, and yesterday, Dr. Williams announced that schools are going to remain closed in Southern Ontario for another 2 weeks. When we talk about workplace safety, Dr. Fulford, should we also be talking about outbreaks in schools?
Well, actually, schools have not been a big source of outbreaks. And again, we have to be very careful how we define outbreak. But if you look at the numerator, the number of children and teachers that have become sick compared to the denominator, the total numbers, schools have not actually been a significant source of transmission. And this is something that has not been very well explained, I think to the general public. But also, any discussion of an outbreak or a closure has to go with the harm associated with it. We obviously want to control the transmission of COVID, but children, we all know now, it's one of the good news stories of COVID, if you want to think of a good news story, is that children simply do not get severe disease from this. So they are not at risk from COVID, but they are at risk from an interrupted education and from isolation. And so, I mean, sadly, there has been no death in Ontario in a child because of COVID. There was one with COVID, but we have had suicides and overdoses because of lockdown depression. We have massive problems with mental health issues. We have huge, every hospital, I think in Ontario Pediatric Hospital now has surplus of children with eating disorders coming through, with major anxiety, depression. So that's just the immediate one. And that's not even talking about the long-term harm of interrupted education, of loss of reading and mathematical abilities. So any discussion of the closures really has to be a total harm minimization. There are some businesses or areas, I think, where the lockdown is warranted because we do need to control transmission. But I think we have to be very, very careful with the school situation. Schools did an excellent job with infection control measures. Children are not sick.
I just want to interrupt
if you.
you.
Look at even the teachers,
I just wanted to say, because I know that I believe there was an educator in Toronto in the GTA who did die from COVID.
Yeah.
And before the break, we had there was testing at a school, and they found a lot of asymptomatic cases. And I think the minister yesterday on an interview said that they are going to start doing asymptomatic testing more.
And I think that would actually be useful to get a better sense of what's going on. But part of the asymptomatic testing, if we're going to do that, should also be ensuring we know where the COVID was acquired, because studies have actually shown that children, it's more frequently in outside gatherings than in school. The CDC actually published a report in December looking at that, and I think we all would know that in the United States we've had a large amount of transmission. Is pretty much, I think we all would acknowledge, out of control. And even there, they showed that the children who had COVID were much more likely to have gotten the COVID outside of school at social gatherings and not within schools. So it's just a balance. It's not to say that there will never be transmission in schools. It's not to say that we can ignore it. We clearly have to continue the mitigation measures, but it's really important, I think, to also think of the impact on children. And the impact on children now is not because of COVID. The impact's because of the response to COVID.
And Victoria, you know, when we do talk about community outbreaks, kids go to school, they come home, maybe their parent works at a factory or at a grocery. Would this information be useful to understanding how COVID is being transmitted?
Yeah, I mean, I would hope so. And I think the piece around the schools is very complicated. And obviously, as a parent, I have a bit of a conflict of interest there. But the children are one part of the puzzle. It is also a There are adults in those environments who may be at high risk for COVID and COVID complications. And everyone in that environment, as you say, also goes home. They have family, friends, community, errands that they run. And so the links between these spaces that we're inhabiting, I think we can't overlook in our initiatives.
And we were talking about stigma. Both of you brought it up. I know at my kids' school, there was a few cases, and some of the parents were trying to figure out which child had COVID. Dr. Fulford, could this information, when we talk about, it is going to give us information and we're going to have a better understanding where it is coming from, but could it be used to stigmatize businesses that are experiencing outbreak? And what is in it for the businesses to report these numbers?
Well, and I think that's why it's important to understand why we're going to do this. 2 cases in 14 days would require contact tracing, knowing where the people actually got the COVID, and it may have been community acquired and it's a coincidence. So I think as long as if it's ongoing flagrant breaches of infection control practices or large outbreaks with ongoing transmission, where I think it would be important to maybe publicize the name. But I worry a little bit. There has been a lot of naming and blaming, and this is a terrible thing that's happened, the COVID outbreak. But the vast majority of people are doing their best to control it. And sometimes an outbreak is bad luck. It is not because anything wrong happened. It's not because there were any breaches of control. It was just bad luck. And so I think we just have to be very gentle in how we take this information. It's useful. I think it would be really helpful in terms of reopening the economy, know where the true high-risk settings were. But I also think we have to be very careful that we don't use it to start to, well, as I say, name and blame.
And Victoria, how likely is it that a worker will pass on the virus to a member of the public?
I don't think we know the answer to that, to be totally honest. I think that, I'd like to just note that this initiative to get workplaces to report, certainly there are some questions about how compliant workplaces will be. And as you say, how many workplaces actually will know within a reasonable amount of time if their workers do have COVID-19. But it will be done in addition to all the usual contact tracing and reporting that happens. And so in the vast majority of these reported outbreaks, I would expect that they don't get to that level of having anybody named publicly, but it will help Toronto Public Health hopefully better understand transmission in these workplaces and in the community. I think one piece that is missing is that we don't collect information on where people work systematically as part of the contact tracing process. They do ask about some particular high-risk industries, but they don't ask broadly. So we can't track at a case level in Toronto what occupations or industries are at increased risk of COVID. There are other parts of the province in Peel where they are doing this, and they are able to see which industries are overrepresented. And this is really valuable information in terms of targeting prevention initiatives and supporting businesses to do better in the workplace and to allow workers to better understand the risk, their personal risk, to access compensation. So these are all very important things, but that's the next step in my mind. We've made really good progress on other social determinants of health, like collecting information on race so we can look at structural racism or look at income. And I think that collecting individual level data on where people work through the contact tracing process should be one of the next big priorities. And that does also support one of the other things that I picked up on in the reporting of the announcement this week was Dr. Davila's mention about this growing collaboration between public health and occupational health. And that may be something that your viewers don't realize, that even though from an it's important because academically, we think of occupational health as part of public health. But from a regulatory perspective, they're siloed. So we have the Ministry of Labor, Training and Skills Development that oversees occupational health and safety, and we have the Ministry of Health that broadly oversees public health of many other things, but they're separate. They have different regulations, they have different enforcement structures, and so there are silos there. And COVID is crossing those boundaries, and those groups of people need to come together. And I think that we're trying very hard to do that, but that's a big task, and we need to do better.
Well, speaking of crossing, I think we saw the effects of it when we had the lockdown and people were leaving the lockdown areas and moving to other parts of the province where there wasn't a lockdown. Should the Ontario government be collecting and publishing this information across the province? Dr. Fulford, I'll start with you.
Sorry, which information?
Where the outbreaks are happening.
Probably if you start to get high epidemiology, then yes, it would be useful to know where it's happening. That point about asking people what the contact tracing where they work is actually a very, very important point, because that would also help understand a lot more about transmission, because as we know, we spend a very large amount of our days at work. For those of us who are, well, like me, who come into work every day and don't have the luxury of working from home. Again, I think I'd be more interested in publishing, or at least understanding the areas where there's a lot of ongoing transmission. And so knowing that is helpful. Again, not to point fingers, but to have a much better understanding why this is happening. And then for people, well, like occupational health, public health, to go in and actually scrutinize really well why. What's the environment in that workplace that has facilitated the transmission? Because that's a very constructive way of intervening and of preventing the transmission in a way that's educational and positive. So if we know, for example, that it's in this particular type of design in a grocery store or a warehouse, or maybe a multi-business building, to understand, is it the elevators, is it the washrooms, is it the break rooms, is it that the employer's not letting people have any breaks, is it they're not enforcing mask use when they can't have physical distancing. So if we know where the outbreaks are occurring, and then people can go in and have basically analyze the situation, understand it, that's a much more constructive way, I think, of intervening and trying to prevent ongoing transmission.
Toronto City Councillor Joe Cressy has said that they've been asking Toronto Public Health to collect this information for 16 weeks. Is it too little, too late, Victoria?
Well, it's definitely late, but I think it's better late than never. And I think that collecting more and better data about workplaces and about where people work is going to help us better understand this.
And Dr. Fulford?
I would agree with that.
We can't seem to get a handle on this virus. How optimistic are you that we can return to normal? I'll just give you each 30 seconds. Victoria?
I'm trying to remain optimistic. It's definitely a hard time for everyone. And, I'm not, from a work perspective, which is, the context that I study, I don't think we're ever going to go back to where we were. I think that things are going to change. And in some cases, hopefully we can make that a positive change in the case of making workplaces safer for everyone.
And Dr. Fulford?
It will be a new normal. I'm optimistic that once we have healthcare workers vaccinated and the vulnerable vaccinated, that removes a lot of the pressures on the hospitals and the healthcare system, which is, of course, why we're doing this. Will we eradicate the virus? No, I don't think so, but neither do I think we need to worry about that. I think we need to worry about ensuring we've got good protection for the vulnerable. And now with a focus on vaccinating that group, I'm actually very optimistic that we'll start to see things get back to a new normal.
I know you're both very busy, and we are so grateful for you spending some time with us. Thank you so much for your insights.
Pleasure. Thank you.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.